Hi. Hi, I'm Charlotte Godziewski. So thanks a lot for the opportunity to present here. I mean, I've really been enjoying this seminar series a lot. I think it's a really nice and friendly environment, and so I've been really excited to get to present in it as well. So what I wanted to talk about today is an idea for a future research agenda that I'm currently developing. Are you seeing the next slide? Yeah, I assume yes, otherwise something. Yeah, okay. So it builds on the research that I've done during my PhD. And this is why I thought it'd be a good idea to start by talking a little bit about what I did in my PhD, just to give some context about where I'm coming from. So I did my PhD on the concept of health in all policies in the EU. So health in all policies, or HIAP, is a policy agenda that was formally introduced under the 2006 Finnish EU presidency, and since it's been referred to in some parts of the Commission more than others, so of course especially DG Santé. It's intended to be a health mainstreaming agenda based on the recognition that non-health policy areas have an enormous impact on public health, whether that's, food and agriculture, trade policy, or macroeconomic governance, and so on. And so the very idea of HIAP is to take into consideration the indirect, so-called macro-social determinants of health. Macro-social determinants of health are those factors that lie way beyond the agency of the individual. So, for example, cultural, economic factors or corporate structures and so on. And much of that relates to inequalities. So, of course, if poor public health and health inequalities are shaped by wider socioeconomic inequalities, then those policies that affect wider socioeconomic inequalities are indirect determinants of public health. And so this, of course, considerably widens the scope of what is defined as health, what is seen as pertaining to health, and what qualifies as health promotion. And it also makes the politics of health much more visible. And so ultimately, trying to put HIAP on the EU agenda has a lot to do with the struggles of social versus economic EU integration, only that it takes public health as a starting point and as a lens. So what I argued was that HIAP did indeed reach the EU governance space, but that it doesn't mean that it led to any fundamental transformation or change. And so that's because the meaning of the concept is negotiated and reshaped and changed in order to fit existing structures rather than challenge them. So, for example, you could see how in the Commission document, HIAP gradually started meaning new additional things and started developing around a new focus. For example, the need to bring business as part of a multi-stakeholder approach to HIAP or such kind of new interpretations of it. And so this multi-stakeholder approach to HIAP was something that I was told was not intended to be originally part of the agenda. And so this can be explained, of course, by a variety of interacting factors, including power asymmetries in the EU institutional architectures. So the usual kind of constitutional asymmetry, but also the dominance of certain ideational structures and norms, and including how health is defined, right? But, and this is where I'm getting closer to the new research idea, it's also because the HIAP concept itself is intentionally a bit vague and intentionally strategically silent about its own kind of normative and political underpinnings, and strategically silent about the normative and political implications of it. And so this is one reason then why HIAP becomes very malleable and can easily be reinterpreted and also easily watered down. But at the same time, precisely this vagueness and these characteristics are intentional and strategic, because one could argue that if HIAP had been perceived as too radical, then it wouldn't have made it to the EU space in the first place. And so ultimately, HIAP promotes the idea that health is a human right, that it's political, and that unequal societies are less healthy. And it takes a very broad definition of health as being much more than something physical, but including social, mental, cultural, and spiritual, and so on, well-being, as well as the very broad idea of the possibility to flourish, right? But this idea is not new. It's been, of course, around for a very long time, and HIAP is only one version of this idea, or one iteration of it. And so the other thing that I argued is that the same old ideas are being recycled and tweaked and represented by public health advocates and researchers to try and influence policy, to try and have a go at influencing policy. And so one interviewee told me very explicitly that HIAP was an attempt to translate the WHO Health for All agenda that emerged in the 70s and 80s with the Alma-Ata Declaration and the Ottawa Health Promotion Charter, to translate that into EU language. And so arguably what we're seeing now is a move towards the next version of this idea, the now trending kind of concept of well-being economy and inclusive growth. In fact, the well-being economy was in the EU Council document was related specifically to health in all policy as a sort of a continuation of this idea. And so what is the well-being economy? So the European Council defines it as a policy orientation which aims to put people and their well-being at the center of policy and decision-making. It focuses on 4 main areas of investment, so healthcare, education, gender equality, and social protection and redistribution. And so from a public health perspective, I would suggest that this is a new formulation of HIAP, but that also seeks to address the challenges that HIAP faced. So first, the concept emphasizes the central role of the economy. And also, rather than talking about health, we're now talking about well-being. And then these two things together could be seen as an attempt to better reach non-health policy sectors, which is something that HIAP arguably failed to do. So, interviewees or health advocates were sometimes telling that if they try and reach out to DG Trade, for example, then as soon as the trade people see health somewhere in the letter or in the title, they'd be like, oh, that's an error. It should be redirected to DG Santé. And so it's to kind of try and break this silo approach and reach a broader audience. And so using the term well-being, I think, might even signal some awareness of the limitation of the biomedical framing of public health and signal a bit more of an embrace of the political nature of health. Although that's also a double-edged sword, and it's a bit sensitive because public health has had a tendency precisely to draw on biomedical frames to assert a sort of an apolitical, neutral authority. Right, so the well-being economy was a theme of the 2019 Finnish EU presidency, and it's come at a very interesting kind of timing, of course. So when it came out in the second half of 2019, it was not as high profile as HIAP was in 2006. So this is in part because you had European elections, you had the appointment of a new commission, you had Finnish parliamentary elections as well. And, it was, of course, in the middle of the whole kind of Brexit thing. But it's still, it coincides very well with a general emphasis on public health and well-being and sustainability. And so that, of course, has to do, on one hand, with, the pandemic. So the pandemic led the EU to increase its health budget. So you will probably remember that before the pandemic, the plan was to scrap the standalone health program and fully incorporate it into the European Social Fund Plus. But then when the pandemic hit, that was changed. And after a lot of back and forth, it seems that, at least, if correct me if I'm wrong, but I believe that the latest version of the EU for Health budget was agreed to 5.1 billion over the next seven-year period. And so this is, of course, a massive increase compared to the 450 million that was allocated previously. And then the other extraordinary pandemic-related measure, especially if you're interested in EU economic governance and public health, was, of course, the triggering of the general escape clause, which meant that all the coercive measures associated with EU fiscal governance were suspended to allow member states to spend as they saw fit. But beyond the pandemic, arguably, the von der Leyen Commission, it could be said that at least in comparison to its predecessor, appears more attuned to well-being and sustainability. And illustrative of that is, of course, the Commission's new growth strategy, the European Green Deal. And so the growth strategy, of course, ultimately are intended to follow the objectives of the Stability and Growth Pact. But still, as an add-on to that, the European Green Deal really emphasizes the concept of green and inclusive growth. Although, to be fair, the previous growth strategy, Europe 2020, also was supposed to promote smart, sustainable and inclusive growth. So the extent to which it's really a radical kind of game changer is contestable, and I'd be quite interested in hearing your thoughts on that. So green and inclusive growth, what does that refer to? So green growth generally refers to decoupling GDP growth from environmental impact, both in terms of natural resource use and in terms of greenhouse gas emissions. And inclusive growth, according to the OECD definition, is about fairly redistributing economic growth and creating opportunities for all. But these are, of course, highly contestable concepts. So can growth be green? There's an increasingly growing body of research that argue that it's actually quite nonsensical to think that economies can grow endlessly without impacting the environment. So in terms of GDP growth and resource use, for example, whether or not one can claim that decoupling works depends on what kind of measurement you use. So if you look at strictly the domestic material consumption, so the red line on the graph, then it appears that indeed, it's possible to increase the GDP without increasing the DMC too much, or at least to have some relative decoupling in that area. But of course, that is related to the fact that most EU economies are largely service-based economies, but that doesn't mean that it doesn't rely on things manufactured abroad, right? And so if you take a measurement that actually tries to better capture all of the sort of upstream material footprint that occurs prior to entering the domestic territory, so the MF, the material footprint, the green line, then you see that actually decoupling claims don't work or don't hold at all anymore. And in the same vein, whether GDP growth can be decoupled from greenhouse gas emission is also quite questionable on empirical grounds. On one hand, studies have shown that where it is happening, it's not happening fast enough to meet the targets, and it also relies quite a lot on faith in future negative emission technologies, which is perceived by those critical scholars to be a problematic gamble. So as far as inclusivity of growth goes, this is also a concept contested on both empirical and theoretical grounds. So some on the more kind of heterodox side have argued that you could, at least in principle or in theory, very well redistribute wealth and decrease inequalities in a steady state economy, and that growth in and of itself and in aggregate terms is not a sine qua non condition for creating inclusive economies. And empirically as well, it's not clear how it works. So as I was saying before, the previous growth strategy was already calling for more inclusivity in growth. And back in 2012, Daly already was arguing that this notion was not linked to any real and meaningful explanation of how that would reduce poverty and or inequalities, and that therefore the concept as it stood was a bit meaningless. And it's quite interesting because also the European Green Deal doesn't really engage much with the inclusivity part of growth at all. It sets out quite a few policies on the sort of the green side, but very little is said on inclusivity and redistribution and so on. So yeah, nevertheless, one can argue that it's particularly interesting and relevant time to be looking again at whether and how more well-being, more health, more inclusivity, and so on, can be reflected in EU governance, including economic governance. But given what I was saying before about ideas like the well-being economy being quite vague and contested, I think it's very important not to neglect these ideational power dynamics and dimensions. Because, of course, bringing neutral evidence to the table alone is not enough to kind of guarantee political change. And so one of my driving concerns then is to research how and whether and to what effect different EU actors understand well-being economy differently, and how they conceptualize and legitimize the place of growth within the well-being sustainability economy nexus. And I think it matters a lot because an idea like well-being economy is not, objectively existing with one clear meaning, but it reflects, how which definition ends up being adopted and dominating reflects power dynamics and has important implications for how it will be implemented and along what criteria its success will be assessed. And of course, now is a crucial time to be looking at this, given the need to develop a vision for post-pandemic recovery and how a recovery should be put in practice. And so this is where I'm trying to link everything back with the beginning. So how does that all play out in relation to macro social determinants of health? So how are they acknowledged, if at all, and how are they acted upon? And to look at that, I was thinking of focusing on one particular tool of EU economic coordination, the European semester. So I appreciate you're all going to be familiar with the semester, but just for the purpose of introducing the case study, so it's a fiscal coordination cycle. Normally, the semester cycle is based around the Commission publishing budgetary priorities and an annual growth survey in autumn. And then in spring, the Council adopts EU economic priorities based on the Commission's report. And then member states submit their fiscal plans and national reform programs for the Commission to review. And then later in the summer, the EU then publishes the so-called country-specific recommendations. And some member states can be flagged up for more in-depth review if they look like they're not aligning or they're not on track. And the semester is interesting because it's been seen as the link between the social, sort of non-binding, initially more soft kind of governance, and the harder economic governance. And the European Green Deal is explicitly committed to refocusing the European semester on sustainability and well-being of citizens. And so this clearly reflects the idea of well-being economy, which is why I thought it would be an appropriate case study to take. So some have argued that the semester is a tool that can make EU economic governance more social, while others have said the exact opposite, that the semester is a way for economic rationality to intrude in social areas. And then others yet have shown how, instead of trying to make the semester more social actors are actually trying to make it more irrelevant or to hollow it out. But at least in principle, the semester is, of course, highly relevant to public health in numerous ways. So Greer, of course, talks about the various phases of EU involvement in health, So the EU getting involved in health via avenues that have very little to do with health, such as the single market and economic governance. And so on one hand, this happens via the so-called health-related country-specific recommendations, where the Commission tells members or advises members how to reform the health system. But another way in which the semester is relevant to public health is indirectly via the macro-social determinants of health and choices about public expenditure beyond health systems. And so what I would like to better understand is how evidence and ideas struggle and are used to craft a dominant version of well-being economy, and how that then translates at the concrete policy level through mechanisms in the semester. And whether maybe some of the DGs that are involved in some of the different DGs that are involved in the semester maybe have different ideas about what a well-being economy should look like and how to achieve it, and then how that kind of plays out. Right. So before concluding, just let me. I just want to say a few words about the current state of the semester, because now it's been the process has been changed because of COVID. So the timeline is different, and it also kind of works together with other recovery tools that were set up. So you have the Next Generation EU, and then the Recovery and Resilience Facility, which also makes available funds and loans and grants to support reforms and investments undertaken by member states. So there's going to be a kind of an alignment with the European semester and those new kind of COVID-related mechanisms. And so the national reform programs, I believe, will be merged with the recovery and resilience plans and align with these new mechanisms. So, for example, I don't think there will be country-specific recommendations this year. And also, yeah, as I was saying before, the corrective measures have also been suspended. So it's really an interesting development worth following to see how this maybe changes the semester also in the future because of this kind of unique post-pandemic or pandemic context. Yeah. So to conclude, I would say that my starting point is a concern for macrosocial determinants of health and the challenging relationship between research and policy. And how research evidence informs policy, and and the politics of evidence in the case of well-being economy. So similar ideas that ultimately are about macrosocial determinants of health get recycled, adapted, and strategically repackaged, and then presented as new. And arguably the latest version is well-being economy, which at the moment seems to go hand in hand with inclusive growth, or green and inclusive growth. And so by looking at the European semester as a case study, I want to better understand how this idea plays out in EU economic governance. I want to examine the politics of defining well-being economy, if you will. Yeah, so I think it'd be useful to look at various DGs involved in the semester process, but also the relationship with member states and how member states influence it and how they perceive it, and also maybe how that works with maybe their own kind of domestic well-being economy agenda as well. And finally, and I've left this for the very end, even though I'm actually really interested in that, but I'd also like to see if there's any space for dissenting ideas and what kind of role they play. So I mean, for example, versions of well-being economy that actually challenge the economic growth premise in the first place. So what their role is and whether they are present at all in the discussions. Yeah, that's already it for me. Thank you.